Welcome everyone to the Children's Safety Network application information session for the Child Safety Learning Collaborative. I'm Jenny Stern-Carasone. I'm the Associate Director of Children's Safety Network, and today I'm going to do a brief overview of what the Learning Collaborative is, the different components and how it works, and then what the application process is, and then really dedicating the majority of the time we might be spending together to all of you and any questions that you have. As you're joining, I encourage you to please add your state abbreviation to the beginning of your name so that we just get a better sense of geographic distribution. And you also can see if there's anybody else from your state that's joining, because as you'll hear, the Learning Collaborative is really truly about building networking and peer connections. So very briefly, a few technical tips. I think everyone is generally very familiar with Zoom. Audio over computer is best, but you can also join in on the phone. If you need help with that, please shoot a note in the chat or send it to Children's Safety Network, our host. We do ask that you stay muted when you're not the speaker, but we are leaving lines open so you can unmute at any time. And we really do want you to feel like you can engage either verbally or just posting things in the chat so that we can address any questions that you have. And at the very end, when we move into our question and answer component, we encourage you to turn on your cameras if that's comfortable, again, just so we can build some connection with one another. Once again, for those who have just joined, if you're able to add your state abbreviation before your name, it just helps us to understand better about our geographic distribution of who's here and gives you an idea of who else might be joining from your state. We're recording this session and it will be posted and archived on our website to share with colleagues as we are winding down our application process in the next couple of weeks. I also want to just acknowledge our funding sponsor, and today's presentation and all the work that is done at Children's Safety Network is done through the funding and support of the Health Resources Service Administration. Nothing that we say today should be regarded as the word of the government in any way. It is our own work. So I'm really excited to share this wonderful opportunity for you to consider joining the Children's Safety Network's Child Safety Learning Collaborative. The Learning Collaborative is a very unique effort that is focused on reducing fatal and serious injuries amongst infants, children, and youth ages 0 to 19 through the support of a collaborative improvement amongst state and jurisdictional level Title V agencies that are working to address child safety. We do this by sharing the best available scientific knowledge on the prevention of injuries and using ongoing quality improvement methods so that states and jurisdictions can begin to implement a coordinated system-wide approach to injury and violence prevention. So I'm going to break that down a little bit more in the next couple slides. So first and foremost, the application process. We are in the last couple weeks of this application process, and we only open up this application process every 18 months because each cohort is about 18 months. So you are in a prime opportunity to join the first cohort. All applications must be submitted by the state or jurisdiction Title V agencies, such as your public health department, with representation by the maternal and child health director or the injury and violence prevention director or an appropriate designee. Please note, it may be that you today are joining and you are not a maternal and child health director or injury and violence prevention director, or not even a member of your public health department. That is okay. And it is great that you're here, and we would hope that your state will pull together a team that you would be a part of. So it may be that the activities that are conducted by the teams that are joining the Learning Collaborative may really be predominantly driven by non-Title V members, but with the support and oversight of Title V. We know each state infrastructure is set up very differently from one another, and that it may be that you don't have the specific roles or titles that I've noted. And I think that Lauren is going to post in the chat a link to help you to know who is that designated person that you would need to be in touch with in order to really drive the application process and submission. This support is important because it's who we're mandated to support in our work promoting Title V success, and then gives you the leadership and political will to be able to do this work on a statewide basis. Once again, the Learning Collaborative is set up over a 5-year period, and we run 3 cohorts, each of them 18 months. So this is a great opportunity to get in right at the beginning. And we have found that we have many teams that join in a cohort and then continue on to successive cohorts, because the idea is that we are trying to align the work of the CSLC with the priorities that already exist in states. And we're trying to just accelerate and augment the work that you're already doing, not adding something new. And so a lot of states find that this is a supportive environment to stay in over a course of time. CSN has analyzed data trends and maternal and child health national performance measures to identify injury topics that are the most significant injury rates, but also have the greatest potential for progress. So with that information, we are going to be addressing the following 5 injury topics: bullying prevention, motor vehicle traffic safety, which includes both child passenger and teen driver, sudden unexpected infant death prevention, and suicide and self-harm prevention. And then we will be adding drowning prevention in cohort 2 and cohort 3. So for cohort 1, it's just those first 4 topics. And then cohort 2 will also add in the addition of drowning prevention, and we'll continue them with all 5 topics for cohorts 2 and 3. We encourage teams that are joining for the very first time to consider only joining one topic for your first go around, unless you're feeling confident and established and want to take on 2 topics, but no more than 2 topics for your first go around. And then again, for any teams that want to continue on into successive cohorts, we encourage you to consider then expanding your reach and maybe having another team to develop and join an additional topic. So a little background about how the CSLC is designed and some details on our approach. Everything we do is grounded in our CSN framework for quality improvement and innovation in child safety. The framework focuses on building public will and state jurisdiction capacity in key areas that are essential to achieving sustainable and scalable child safety results. The cornerstones of our approach to capacity and coalition building include the identification and use of data-driven, evidence-based, and evidence-informed strategies and programs, increased effectiveness of management and leadership, and the ongoing commitment to shared learning and principles drawn from advancement and improvement in implementation sciences. Health equity is infused throughout the entire framework to ensure disparities are addressed and that equity is a focus of our work. You can access and download our publication on the CSN framework, which includes examples from prior learning collaboratives of how states have implemented this framework and the learning collaborative approach to advance the work in their own states. This is available for free on our website. I'll just pause for a moment for anyone who wants to grab that QR code. Okay. So as stated earlier, the primary goal of the collaborative is to reduce fatal and serious injuries amongst infants, children, and youth ages 0 to 19 through the support of collaborative improvement among state and jurisdictional level Title V agencies who are working to address child safety. Within each injury topic, the focus of the work of the collaborative is to identify areas ripe for improvement, to support states and jurisdictions in developing a knowledge management system to support innovation and sustainability, and to use real-time data to inform decision-making and rapid improvements, which ultimately will enable states and jurisdictions to implement and spread evidence-driven strategies and programs that will reduce childhood deaths and injuries. The Learning Collaborative uses evidence-driven strategies and programs that are aligned with the injury-related maternal and child health national performance measures and also meet the following criteria. These strategies and programs have been shown through research and data to have the potential to close a significant gap between current prevailing practice and the best scientific knowledge in injury and violence prevention. They also show potential to contribute to the reduction of injury deaths, hospitalizations, and emergency department visits among infants, children, and adolescents. And they have demonstrated feasibility and potential for breakthrough improvement by at least some states and jurisdictions. Within CSN, we are a comprehensive technical assistance and training center that includes a research arm with the Pacific Institute for Research and Evaluation, and we also have a national Children's Safety Now Alliance that is comprised of members from universities, federal organizations, and other nonprofits and organizations that are focused on child safety and injury prevention. So all of that contributes to identifying what these strategies are that are going to be most effective in helping to move forward injury prevention. The design of the Learning Collaborative is grounded in the Associates in Process Improvements Model for Improvement. You may be familiar with this, and the Improvement Guide, which is sort of the Bible to quality improvement or continuous quality improvement. This model centers on clarifying the aim, or what is it that you're trying to do and what do you think you're going to accomplish? And then the determination of what the changes are that you think are going to result in that improvement, and the data that you're going to need to collect and analyze in order to know if the change is actually an improvement or just a change in circumstances. Throughout the course of the collaborative, we will be building on this model and utilize a variety of quality improvement tools to track change over time. Those include Plan, Do, Study, Act cycles, which are a primary tool enabling teams to conduct small tests of change to effectively try out new child safety approaches and interventions within your system in small environments in order to then ascertain whether you're going to adapt them, if they need to be modified or changed, if you're going to abandon them because they're just not working, or if you are seeing that it's working and you're ready to adopt that and then scale it up to working with more sites or a greater population base. Another key facet of the Learning Collaborative is the identification and use of evidence-based and evidence-informed strategies. As I said, it's one of the cornerstones of our framework. CSN has created topic-specific change packages that will guide and support the Title V work. These resources identify the strategies selected to align with Title V MCH goals and that have that greatest impact and potential for reducing injuries. The change packages are organized around the social ecological model, addressing societal, organizational, and relationship interventions, and they provide process measures that will help you to track real-time change. And then we have as I'll explain in a moment, a monthly reporting expectation where then we'll be creating charts to help show your change over time and help to drive your work towards greater acceleration. We ask that teams choose 1 to 3 strategies and the associated measures. So we're really asking you to just focus your work on kind of a microcosm so that you can really build the skills and resources that you need to then scale up and expand your work to a greater level over a shorter amount of time. We are designed to convene state strategy teams into topic teams. And I'm going to talk about what a strategy team is specifically in a moment. But the topic teams are where all of the states that have chosen a specific injury topic will come together on a monthly basis for a virtual call where you'll be able to share what's going on in your state, talk about the strategies, their success, the challenges, the failures and lessons learned, and really learn from one another. We run our entire collaborative under a data sharing agreement that establishes a level of confidentiality so that you can feel secure in being able to come and bring your full self to these meetings, knowing that you can just be a peer and a colleague with these other state topic team members and really get down and dirty about sharing what's going on and learn from one another. And that's where we've seen our greatest success. This is the all teach, all learn, where we're working together in order for the entire learning collaborative to demonstrate collective impact. So the strategy teams, the topic teams, as I said, are comprised of these state strategy teams where each state applicant is choosing 1 to 2 topics that they want to work in. And then the team composition of the different strategy teams may or may not overlap. Your Title V leadership is going to be the same, and they're going to support whatever topics you want to work in. But then in terms of the actual roles and membership of each team, it may be that they're completely separate from one another, or it could be that you have overlap between those 2 strategy teams. So what that looks like is that you have your organizational design where you have your leadership and support And then you've got your Title V staff and other partners that might be working on that with you. And then whatever community-based or organizations, partners, pilot sites, and others that then would be part of that team. So other recommended members could include state agencies and divisions, community-based organizations, some project managers, regional partners. Having an epidemiologist at your behest is really helpful. We understand not all states have child injury epidemiologists or may not have somebody who can be solely allocated to your work. But again, part of our technical assistance will be helping you to identify somebody within your realm that can be an asset in helping you to access the data that is necessary for you to continue to analyze the progress that you're making and ascertain if you're really getting to the improvements that you want. So I'm going to give you just an example of what a state strategy team might look like from teams that we've had in the collaborative previously. So it may be that a state health department decides to partner with the State Department of Transportation to implement graduated driver licensing education and compliance in an effort to improve teen driver safety and reduce injuries and fatalities related to teen drivers. So the Department of Transportation then engages local health departments and schools to implement a driver's education program targeting GDL awareness and begins implementation first in one district. Then after testing that and seeing that, the approach is working, then they move to work with all the districts in one county. And again, giving that time to assess if now that approach and scaling it up to all the districts in one county is working, then the districts in several counties, and ultimately working towards a statewide implementation plan. So the strategy team, again, which has membership from state health, Department of Transportation, schools, and local community organizations, including perhaps driver's ed, have all been working together on this scalable approach. And then the strategy team is utilizing their state epidemiologist to identify and collect relevant data that will help to inform and support their work, and is also perhaps conducting evaluations or other data collection processes within the pilot sites, those schools that are implementing the GDL awareness and compliance trainings, to ascertain whether or not it's an effective implementation. So I want to acknowledge also that, if you want to learn a little bit more about how to build effective partnerships and team collaborations to do this type of work, we encourage you to come next week to our State Technical Assistance webinar, where we will be delving into the role of partnership in Title V work. And Lauren is posting a link. It is not a registration event. It's open to anyone to join. And it happens next Thursday, the 21st. And we just encourage you to join or share it with your colleagues to be there as well. So expectations, if you are choosing to join, you want to know, what am I getting into? I get it. I like the model. It sounds like it really aligns with my work, but what is really entailed? So as you see here on this slide, the total participation time is really going to vary from team to team, but we expect and have seen that it's at least a minimum commitment of 2 hours a month for regular learning collaborative activities. This includes a monthly call that alternates between the member-only topic call I was just describing, and then the state technical assistance webinars that happen on the alternating months. And then the submission of your Plan, Do, Study Acts, and the collecting and reporting of regular monthly data. So those are the required activities that we ask of teams. Again, required meaning we ask you to do it because it's going to help you and it's going to help us to be able to help you. But there's no funding attached to this from us, so we are not going to hold your feet to the fire or strap you down if you don't do something. But that is where you'll get the most of your effort if you're able to comply with those expectations. And then we also encourage that you're setting up your own internal meeting and implementation strategy, which would, then vary in terms of the amount of time, but hopefully is already aligning with your work priorities and what you're doing at this time. So once again, All Teach, All Learn is the real foundation of what makes the learning collaborative work. Okay, the activities themselves, I've sort of begun to reference this, but just to give you kind of a outline of the schedule for this first cohort. Once teams have been accepted to the Learning Collaborative, we will launch the activities with a new member orientation webinar. We'll host it twice. You'd only have to attend one. At these orientations, we'll be setting a foundation of what to expect and some more of the principles and methodology behind the work that we do. Talking about the change packages and how they work, and how you'll be utilizing them, and then helping to start you to begin your strategic planning. Then we are going to use the months of November and December to set up individual team meetings with each of the strategy teams. So your topic lead would reach out and schedule a time to get together with whomever you deem is appropriate to attend an individual consultation, where we're going to really dig into understanding more about what your landscape is and assessing what your needs and strengths are, so that we can better set you up for the strategic planning and development that you need to get started on a strong foot. Then the real work begins with the learning session. And so throughout the course of each cohort, we will be hosting learning sessions where the entire Learning Collaborative comes together for an opportunity for cross-cutting strategy, education, a lot more quality improvement education, and again, phenomenal time for peer learning and collaboration across child safety and injury prevention as a whole, as well as some dedicated time to the topic specific areas. We're excited that at the beginning of the very first cohort, we have the opportunity to actually host this in person. The majority of these learning collaboratives will be hosted virtually, but the first one will actually be hosted as a hybrid, where we will have the opportunity to sponsor 1 to 2 members from each team to attend our in-person portion of the learning session in our home offices of EDC in Waltham, Massachusetts. And then we'll design a hybrid opportunity for team members that we're not able to bring in person. And this, again, will be an opportunity to really dig in deep and get a lot more training around child safety and injury prevention and the methodology behind the Learning Collaborative, and to set your strategic plan in stone. Following that, we will start the every other month, where we have topic calls 1 month, and these are all pre-scheduled, and you'll receive calendar invitations so that they're secure in your calendar, where you'll come together with other states working on the same topic and can really dig in deep to the corresponding work that you're doing and learn from one another. And then on the alternate months, we host a one-time state technical assistance webinar, where we're really going outside the bounds of the CSLC specific topic work and looking more generally at cross-cutting strategies and work to advance child safety and injury prevention. And this is open to more than just CSLC membership, and is designed as kind of a workshop TA session. And then, as I mentioned, the other expectation and commitment is to submit monthly reports. We have a very easy, secure online form that aligns with the change package, where you would just go and input the data that you've collected, and then you'll be able to get specialized, customized TA response from your topic lead that then can lead to further technical assistance and support for the work that you're doing moving forward. So to wrap things up, as a reminder, we are in the final couple weeks of our application process. There's still plenty of room in the Learning Collaborative, and we strongly encourage folks to join. This first collaborative is always the real germination of things, and as I said, is a great opportunity because we are able to host an in-person learning session, and have found that the ability to meet one another and to establish that networking can really accelerate and advance your work. So Lauren has shared a link to a PDF copy of the application so that you can get a forecast of what's expected. You'll see it's pretty straightforward. It's not intended to be cumbersome or to outcompete one another. It's just really to ensure that this is the right alignment for you and that you have the leadership support that you need. And then we'll really dig into the nitty-gritty of understanding more of your landscape and needs and capacity in those individual consultations. And if you are interested in applying, the online application is available by emailing csninfo@edc.org to receive a unique link to the application so that you can open and close it at leisure and share it with appropriate people for signatures before submitting. We do ask that applications be submitted by end of day on September 27th, so it's a week and a half away. And if you have any questions, reach out to me at any time. So I am now going to stop my share and move to opening up for discussion and questions. I have not paid any attention to the chat, Lauren, so.
I haven't seen any questions come in yet. I've been typing in a couple times to ask people to please post their questions or to wait for the Q&A, which is right now. So you should feel free to either type in a question or just unmute yourself and ask us.
So I'm looking at the participant list and I see that we've got some folks from Louisiana, from Pennsylvania, both are states that have previously participated in our learning collaboratives. And have found some really great success in the work that they've done. So it's exciting to see new folks coming and showing some interest in this. Ohio, we have not yet had an opportunity to work with the state of Ohio in our learning collaboratives. It would be wonderful to explore that. Same with Utah. So, lots of great opportunities to really dive in and try something new.
So feel free to ask any questions about any of the specific topics or about the general process, either of the application process or the process of being part of the collaborative.
Hi, this is Kayla from Children's Hospital in New Orleans. I just had a quick question of if any of this information that you gave out today would be maybe emailed to us or something like that we can share with our other team members that weren't able to join.
Absolutely, Kayla. Great question. So yes, we will be following up. If not later today, then tomorrow we'll be sending out a follow-up email that has all of the information, including an archived recording from today's event to all of the registrants. So you'll receive that. And once again, we have had the pleasure of working with Louisiana in several different settings over the course. We've been running collaboratives since 2015. And Louisiana has been a participant throughout all of that time at some point or another. And so we would be happy also to help facilitate connecting you to, and this goes for anyone, connecting you to your Title V leadership so that you can further explore how to partner. We've had Children's Hospital has been a great partner in several other states in helping to lead and really champion the work being done within the CSLC through Title V support and encouragement.
Great. And I'll actually send my email. I think you have my coworker's email and she's out. So I'll actually send my email in the chat. That way you can follow up with me.
Fantastic. If you don't want to do it in the public chat, just send it to the Children's Safety Network private chat. That's fine. Either one. Joe, great question. So if I wasn't clear, I apologize. No, you are not expected to focus on all. In fact, we prefer that you not. We encourage that as teams are joining, as states are joining, that you select one, maybe two topics. So Pennsylvania, for example, had previously been working with us, and they had a team that was working on bullying prevention, and then they had a completely separate team that had different membership, but similar Title V support, that was working on sudden unexpected infant death prevention. And so they were running two teams simultaneously. We've had other states that, have had, up to 3 teams. That's quite a bit because oftentimes there may be like one person that's kind of coordinating all of that. Like Texas, they had 3 teams that were running at the same time, and they did have some overlap in their membership, and that definitely puts a bit more onus on those individuals. But again, the team composition is going to be generally different from topic to topic because, you know, in general, you're going to have, you know, different specific partners that you're working with that are working on bullying prevention that would not be working on sudden unexpected infant deaths. So in that way, you can, you know, work on multiple topics, but we certainly encourage that you just focus on one topic at a time, and a strategy team itself would just focus on that one topic. Oh, great. Okay, so I see Joe is saying you're working with bullying, but specific to children and youth with disabilities. And that is, you know, definitely a population. Lauren, I'm going to turn that over to you as the bullying prevention topic lead, you know, that you can address that a little bit more about how that fits in with our strategic approach.
Okay, sure. Joe, we would be happy to have you as part of the Learning Collaborative. I was actually at a conference in May and we had a poster session and a few people came up and specifically talked to us about how it would be important to have part of our focus as in this learning collaboration that's more specific to children and youth with disabilities, because that's definitely an important population of focus in this area. So we would love to have your expertise to share with others, and hopefully it would be, I think it really would be a learning opportunity for you as well. We try to share lots of resources, you know, local and national, and lots of examples about different strategies for bullying prevention. So if you're able to, actually Pennsylvania has been participating in the past this at the state level, specifically around their local programs for implementing the Ulvaeus bullying prevention program at community-based agencies. But I would be happy to connect you with them, and then you could apply, you know, for this year and be the, you know, and come to participate in the learning collaborative topic calls with us.
And just to further what Lauren was saying, again, the change packages that I mentioned that really drive the work, you know, the change packages are set up to identify those strategies that are evidence-based and evidence-informed that are going to attend to the highest need populations. So, you know, we would be looking, since we recognize that children with disabilities is one of those populations, the change package would be looking at, you know, what evidence-based, evidence-driven strategies are going to help promote bullying prevention in that area. And yes, Abby is the person who is leading the bullying prevention team for the state of Pennsylvania.
Oh, good. I just actually made a note to myself, connect him with Abby. So we don't have to do that because you're already connected. Yeah, it would be great if you joined. I think we'd be really interested in your area that you're focusing on to be part of the discussion.
Other questions? And if you're feeling shy or you just need to kind of digest this, again, I welcome you to reach out to me at any time. I'm happy to, you know, get on a phone call, you know, with other folks, if that would be helpful, that, you know, weren't able to attend today, or answer any questions that you have. You'll see again that the application is intentionally very simple and straightforward. It's not intended to be a barrier. You know, we've got, especially in this first cohort, a lot of availability, and we really are excited to get states engaged and on board. You know, it's important to have, you know, enough to really build a collaborative synergy. And so, you know, please take this to heart, think about it, reach out about how to connect with your Title V leadership. And, you know, we sincerely hope to see you joining. And if not, then perhaps you'll consider joining us again in 18 months when we launch the next collaborative. All right, this time was truly intended to just answer any questions. And so we've achieved our priorities of providing you the overview, and barring any other questions, I'm going to go ahead and conclude us.
Thanks, everyone. Have a good rest of the day.
Thank you.